she said, "He needs to go to the emergency room and you need to go right now."
I felt like I was drugged. It doesn't seem real because I don't remember.
It was like she was possessed.
I think Andy and Janelle thought he might not make it home again.
I froze for a second. I remember thinking, she's dead.
Next, two medical mysteries that defied the experts. When Kristen Gunther begins suffering from bizarre delusions, doctors fear she may hurt herself, or even worse, another patient.
It's like somebody's telling me a story about someone else.
I never felt so helpless in my life because I didn't know where to turn.
Then, nothing could have prepared little Tyler Berchielli and his family for the harrowing bouts of stomach pain that would leave him looking almost disfigured.
Tyler reminded me of a third world malnourished child with a big distended abdomen.
In the elevator, Tyler asked a question. Are they gonna cut me open with a knife? And at that point, my heart just stopped.
When environmental consultant Roger Gunther met Kristen Danuski through an online dating service in 1998, he felt an instant connection with the 26-year-old music store clerk.
As soon as I met Kristen, I knew that we were destined to be together.
It didn't take long for Kristen to arrive at the same conclusion, and less than 3 years later, they were married in Clymer, New York.
We're very much in love. We're best friends. Our house was full of happiness and fun.
Both Kristen and Roger were also eager to start a family, and in October of 2003, their son Owen was born.
I always wanted to be a mom. It was always just a dream of mine to have a baby.
We had everything that we had ever wanted at that point, and couldn't imagine ever being any happier than that.
Shortly after Owen turns 2, Roger and Kristen decide to move to Delaware to be closer to both their families.
It was a pretty magical time for us, being in a new place and just being together.
But just a few blissful months after settling in, Kristen wakes up one morning feeling very strange.
I would have high anxiety. I felt like I was going crazy and was having a really hard time calming myself down.
Over the next 2 days, Kristen does her best to manage her growing anxiety. But Roger doesn't realize how bad her mental state has become until one afternoon when she calls him unexpectedly at work.
When I picked up the phone, she hesitated when I said hello, like she was struggling to find words.
I got really confused. I didn't know who I was talking to.
She said to me in a very groggy voice, "Can you please come home?" I grabbed my stuff off my desk and ran out the door.
I felt like I was drugged. I was very confused. It just was like a switch flipped in me.
A half hour later, Roger comes in through the front door of his home, and he's greeted by a shocking sight.
What I saw was Chris's feet. They were sticking out of the bathroom, and they weren't moving. I froze for a second, and I remember thinking, she's dead. I made her look at me, and her eyes wouldn't focus on me at all. And she was trying to speak and couldn't. I grabbed my cell phone, I called 911.
While the paramedics rush Kristen to the nearest hospital, Roger wakes 2-year-old Owen from his nap and heads directly to the medical center. But once at the ER, Roger is shocked to find his wife on a gurney, all by herself.
She hadn't been seen yet by a doctor. When I called to her and touched her shoulder, she didn't react, she didn't respond, and I was really alarmed.
Frightened as he is, nothing could have prepared Roger for what happens next.
I looked at her eyes, and her eyes were rolling back. Her face was trembling and twitching. It looked like she had been plugged into a light socket. I yelled out, "She's having a seizure."
Suddenly, the medical staff is on high alert.
They put a bite block in her mouth, and very quickly she was sedated. They intubated her and then just took her away. It was the most horrifying thing I had ever seen in my life.
While Roger waits anxiously, doctors take a CAT scan of Kristen's brain. 2 long hours later, the results come back, but they raise more questions than answers.
They came to the conclusion that she hadn't had a stroke, and they didn't have a good indicator that she had any kind of a brain tumor. So they started looking for other things. They did run an MRI, and when the MRI results came back, there was what they called an abnormality. There was a fuzziness, just sort of an area of maybe swelling or inflammation right smack in the middle of her brain.
The doctors suspect that the abnormality is an infection, and they immediately run a battery of tests to confirm their hunch. In the meantime, Kristen seems to have stabilized on her own, but the episode has clearly taken a toll.
She looked a little pale and a little exhausted, and she didn't really remember much of how she had gotten to the hospital.
I remember them wheeling me into the doors, being on the gurney in the hallway, but I don't really remember anything else from that day.
The next 3 days seem to go by in slow motion as Kristen and Roger anxiously wait for the test results.
We were both hopeful at that point that they were going to find something, and, it would be a course of antibiotics or something, and she would be fine again.
Finally, the findings are in. Kristen's white blood cell count is on the high side, a typical symptom of viral meningitis, an infection of the meninges, the thin lining that covers the brain and spinal cord. There's no treatment for the disease, but the body's immune system can usually fight it off on its own. Patients just need rest, fluids, and plenty of pain relief.
I remember thinking, well, she'll recover from it. She'll be sick for a couple of weeks, and we'll all be okay.
The doctors find Kristen's seizure baffling, but suspect it's in some way linked to the meningitis. They put her on anti-seizure medication just to be safe, and after a week, a worn-out Kristen returns home to complete her recovery.
They basically determined that she needed to follow up with her family doctor.
But just when the Gunthers think they've turned a corner, Kristen experiences an alarming setback. At 3 a.m. that morning, Roger is startled by the sound of his wife crying.
At first thinking maybe she's just having an anxiety attack, she said, wait a minute, why am I here? How come I'm not in the hospital? How did I get home? I don't remember getting home. It was terrifying. All I could think of was I need to get her to the hospital. I was really scared.
By midsummer of 2002, Janelle and Andy Bercielli had been trying to conceive their first child together for almost 2 years.
We finally just gave up and said, I guess we're not meant to have any children, and we'll just let nature take its course, and if it happens, it happens.
The young couple remains hopeful, but in the meantime, they're content to focus all of their energy on raising 8-year-old Isabella, Janelle's daughter from a previous marriage. Then, 3 months later, on a whim, Janelle takes a pregnancy test.
It came up positive, so it was like, okay, I'm pregnant. Oh my gosh, I'm pregnant.
She's like, guess what? I was really excited because for me, it'd be my first time going through the whole baby experience.
On June 28, 2003, 7-pound, 3-ounce Tyler Bercielli is born.
He was perfect in every way. He had 10 fingers, 10 toes, it just a perfect little angel.
When Tyler turns 6 months old, Janelle introduces him to solid foods, just like she did with her daughter. But she isn't prepared for his reaction.
He didn't really take it that great. He didn't eat it that well, but, he kind of got a little bit down.
2 weeks later, she is alarmed when she realizes that her son hasn't had a bowel movement in days.
And then it continued on to a couple days, turned into a week of no bowel movement.
The experienced mother is now sure that something is very wrong with her son.
You could tell that there was a level of pain there, but he was pretty good at hiding it.
She immediately takes Tyler in to see the family pediatrician.
She felt Tyler's tummy, and she said, it feels a little firm, but, nothing's really wrong with it.
The doctor assures her that breastfed babies often experience a little constipation when they transition to solid foods. She prescribes a gentle laxative and instructs Janelle to give it to him once a day. Relieved that there is nothing seriously wrong, She diligently follows the doctor's orders.
I did what she told me to because she's the doctor.
They give Tyler the laxative as instructed, but he just seems to be getting more uncomfortable.
He was crying a lot in pain. It just didn't seem right to me.
As time went on, I became more and more aware that something was definitely wrong.
Then, along with Tyler's stomach pain, comes a shocking new symptom.
It's like his belly never went down to a flat little belly. He always had a little pot belly.
I was starting to get worried if that was causing any damage to him, not having a bowel movement for 2 weeks.
Over the next 12 months, Janelle takes her son to a series of doctors. But over and over, she's told the same thing. Tyler's bouts of constipation are normal.
Tyler was miserable, as you can imagine. We knew that there was something wrong with him, but the doctors were not helpful.
One doctor even theorizes that all of Tyler's problems are in fact psychological.
He said that it's quite possible that one time that Tyler went to the bathroom and it hurt, and so then he just decided that I don't like that hurt feeling and I'm just gonna hold it back.
That was so ridiculous. I just couldn't believe that anybody would say something like that.
As their frustration with the medical experts mounts, the Burchiellis decide to take matters into their own hands.
I felt like I couldn't trust any doctor.
They just kept throwing answers at us and nothing really seemed to stick.
Janelle soon begins experimenting with a variety of home remedies, from fruit juices to homemade muffins to infant massage. But despite all her efforts, Tyler is still only having a bowel movement once a month.
You feel sad, you feel bad for him, you feel like you should do something to relieve his pain or do something to make him more comfortable.
Then, just before Tyler's second birthday, Janelle notices a terrifying new symptom.
One day, his little tummy just seemed more bloated than normally, and it just was really, really hard, almost as hard as a rock, and I just knew something wasn't right.
That was very scary. This little guy was so sick, and he was so miserable.
Janelle packs Tyler into the car and races him to the pediatrician's office. As soon as she feels Tyler's abdomen, the doctor orders an X-ray. For the first time in a year and a half, she seems to be taking Janelle's concerns seriously.
The doctor comes back into the exam room and brings the X-ray with her and shows me that there is a blockage.
The doctor's concerned that if they don't remove whatever is blocking Tyler's intestines immediately, a severe infection could develop.
I was pretty scared because she was really serious about this. It needed to get removed.
Willing to try anything at this point, the Burchiellis agree to let the doctor administer a powerful medication through an NG tube, a plastic hose that goes through Tyler's nose and down into his stomach.
They didn't sedate him. I can't imagine them doing that for a little boy.
Judy and I had to physically hold him down because he was just kicking and screaming and just freaking out. He had never done anything like this before, so it was very traumatic for him.
After 2 excruciating hours, it's clear the medication isn't doing the trick. Tyler is still blocked up, so the pediatrician orders a series of enemas.
One nurse was doing an enema, and the other nurse was also helping hold him down as well. And they basically kept coming back in to do this like every 20 minutes, over and over and over again.
Over the next 3 hours, Tyler endures 4 enemas during each hour, all in conjunction with the potent medication being pumped through the NG tube. And still, the blockage isn't budging. Janelle and Judy can't quite believe what's going on, but they're struggling to keep it together for Tyler's sake.
He was fighting us for all he was worth. It was a miserable experience. It was like torture.
After collapsing and experiencing a horrifying seizure in the ER, doctors diagnosed Kristen Gunther with an infection of the brain. But when they send her home to recover, she begins to suffer from terrifying delusions that land her right back in the emergency room.
We're right back to where we were a week ago. I found myself standing there without any idea of what was going on.
After examining Kristen, the ER doctor decides she's having a bad reaction to the anti-seizure medication and hooks her up to an IV to flush the drug out of her system. But as they wait for the treatment to take effect, Kristen's behavior grows stranger and stranger.
She was agitated and confused and angry. Her face was set with angry lines, and she was speaking very quickly, saying, "Where am I? Why am I here? Why am I sitting on this table?" And it was increasingly paranoid and just very psychotic type of behavior. And the doctors came to the conclusion that it was not a reaction to the medication, that there was something else going on.
Doctors administer a sedative to calm Kristen down. But it's clear to Roger that no one on the medical team has any idea what's causing the bizarre behavior.
The doctors were still proceeding under the assumption that it was some form of brain infection, and maybe they just had missed something. They were too narrowly focused on meningitis, and they were looking for any kind of infectious agents whatsoever that could somehow affect the brain. This is when they started running just an enormous battery of tests. I knew that they were clutching at straws and just trying desperately to find anything that could fit.
Over the next week, more than 7 specialists examined Kristen, to no avail. With each passing day, her mental condition continues to deteriorate. She seems to grow more confused by the hour, and it isn't long before her aggressive behavior gets out of hand.
She managed to get out of her bed. She disconnected her IV and left the room and entered the room of another patient, accused the person of trying to injure her in some way, and at that point she had to have a babysitter in her room. She was strapped down to her bed. It was horrifying to watch. There was nothing I could do.
To control her violent outbursts, Kristen is also kept constantly sedated.
When she would wake from her sedation, she would scream, she would babble, she would talk to people who weren't there. It was like she was possessed. I couldn't communicate with her. No one could.
It's like somebody's telling me a story about someone else. It doesn't seem real because I don't remember.
To make matters worse, test after test finds absolutely nothing wrong with Kristen.
There just wasn't an answer. It was becoming clearer and clearer that the problem was something beyond the knowledge of these doctors.
Then, 2 weeks into her hospital stay, Kristen begins to have trouble breathing.
And I came in and she had an oxygen tube under her nose, and I was alarmed and asked what was going on. They told me that her breathing rate was slowing down and she was no longer able to speak. She was not responsive at all at this point.
The next day, Kristen takes a sharp turn for the worse. Her heartbeat drops to a dangerously low 30 beats per minute, and she's immediately moved into the intensive care unit.
I remember feeling helpless and angry and just saying, "Please fix my wife." I started to think, this is it. She's slipping away from us, and there's not anything any of us can do to stop it.
When the doctor comes in to check on Kristen, he takes Roger aside and tells him something no husband ever wants to hear.
He turned to me and said, "You need to prepare yourself for the fact that your wife is either going to die or she's going to be in a persistent vegetative state for the rest of her life." I never felt so helpless in my life as I did at that time, because I didn't know where to turn.
In the past 18 months, 2-year-old Tyler Bercielli has had less than 20 bowel movements.
We've had Tyler on every prayer list that we've known about. People all over the country praying for him, this thing and that thing.
Every doctor he's been to has assured his parents that he's simply constipated and will eventually start going to the bathroom on a regular basis. But when the family physician takes an X-ray of his abdomen, it's clear that almost his entire colon is blocked. She's now ordered an intense round of enemas to help flush out his system.
I felt horrible. I felt like we were torturing him. Here we are, we've got this little boy who's not even 2 yet, going through this horrible, horrible experience.
After watching her son suffer through more than a dozen unsuccessful enemas, Janelle can't take it anymore.
I'm his only advocate. I need to be his voice. He's 2 years old. He's still a baby.
Even though the doctor is confident that the procedure will eventually help Tyler pass the blockage, his mother and grandmother insist on calling the whole thing off.
We just said, this is enough.
We shouldn't have allowed them to put him through so much pain. The thing is, at the time, you assume that the doctor knows what she's doing.
Janelle does all that she can to help Tyler recover from the nightmarish experience. And when he finally goes to the bathroom 2 days later, the Berchiellis breathe a huge sigh of relief.
I can see the light now at the end of the tunnel here. I was really hopeful that, very shortly we were going to be able to fix this problem.
But just when they think everything is okay, the chronic constipation returns with a vengeance.
The pattern started all over again. First it was a week with no bowel movement, and then it was 2 weeks, and then it was 3 weeks.
Oh, poor little guy. You could tell that he was miserable. He would double over in pain. His abdomen would get so distended, it just looked like it might explode. It was very frightening sometimes.
Desperate to help her son, Janelle tracks down a pediatric gastroenterologist and walks her through Tyler's entire medical history.
She said that we're going to get to the bottom of this. We're going to figure this out. I just was really hopeful that she was going to be able to help us.
Determined to solve the case, the doctor admits Tyler to the hospital so that she can run a series of tests, including an endoscopy, which will allow her to get a detailed look at his large intestine.
We were real hopeful that, this is it. These tests are going to come back and they're going to tell us what is wrong, and we're going to know what the answer is.
But 2 weeks later, when the test results come in, they're nothing short of shocking. Everything appears to be normal. Completely baffled, the doctor tells the Berchiellis that the only thing they can do now is wait and see what happens next. And sure enough, a week later, the crippling constipation sets in again.
Before it was more gradual. This time it was like within a week. We were huge, rock hard belly. He was in a lot of pain. He was crying. He wasn't eating.
Tyler sometimes reminded me of a third world malnourished child with a big distended abdomen and the skinny little arms and legs.
He was just even more sick than we had ever seen him in his life.
I think that Tyler couldn't understand why we as his family, the adults in his life, couldn't fix him, make him feel better. So that makes you feel like you're failing your child. I can't imagine how difficult that was for Janelle.
Beside herself, Janelle takes Tyler back to the pediatric gastroenterologist. As soon as she hears how quickly Tyler is deteriorating, she performs a water-soluble contrast enema test. A radiopaque dye is introduced into Tyler's colon, enabling her to take an X-ray of his large intestine. An hour later, the Berchiellis head home to wait for the results. But almost as soon as they walk in the door, Tyler takes a turn for the worse.
Tyler just started throwing up. And he just kept throwing up, and he just wouldn't stop.
Janelle immediately picks up the phone and makes a frantic call to the doctor.
She said, he needs to go to the emergency room, and you need to go right now.
34-year-old Kristen Gunther has been suffering from a terrifying disease that no doctor can identify. Over the past month, she's deteriorated mentally, experiencing memory loss, extreme confusion, and violent paranoia. Now she can no longer breathe on her own, and her heart rate is dangerously low.
I remember thinking, I'm not going to have the love of my life with me anymore.
With Kristen fading by the moment, the doctors take one last stab at making a diagnosis. They methodically go back over every test result, desperately searching for a clue.
The only thing the doctors had to point to was this MRI of her brain. They started to think maybe there's a tumor in there. We just can't see it because it's so deep. So they made a decision to send her to a research hospital in Philadelphia.
In less than an hour, Kristen is rushed by helicopter 40 miles away to the hospital at the University of Pennsylvania. Dr. Joseph Dalmau, a neurologist, is called in to take on the perplexing case.
I knew that an MRI pointed that she had an inflammation in an area of the brain that's called limbic system.
Unlike the doctors at Kristen's local hospital, Dr. Dalmau doesn't think a brain tumor is what's causing her body to go haywire. However, he's immediately drawn to Kristen's very high white blood cell count.
Increase of white blood cells goes along with the presence of inflammation. Any injury to the brain tissue and results in an inflammation. Injury can be caused by a trauma, by a virus, by an infection, or can be caused by an autoimmune response against the brain. Considering the age of the patient and the symptoms, we suspected an autoimmune disorder.
To confirm his hunch, Dr. Dalmau immediately orders a specialized blood test and a spinal tap. If Kristen has an autoimmune disease, infection-fighting cells called antibodies will show up in her blood and spinal fluid.
The results of both tests were positive. The patient has these antibodies.
I remember him saying, "We think we know what's wrong with your wife," and just being flooded with relief that they knew what was wrong.
When the patient has these antibodies, the patients frequently have a tumor that's called a teratoma. A teratoma is a tumor that is composed of many tissues in the body. These tumors contain, for example, fat, or contain skin. They can even contain teeth, brain tissue.
What causes this particular species of tumor to grow inside the body is unknown. But if Kristen indeed has a teratoma, Dr. Dalmau will be one step closer to solving her case.
In this scenario, we were very suspicious that the patient could have teratoma in the ovaries. For reasons that we still don't understand, teratomas are frequently present in the ovaries.
Dr. Dalmau immediately orders a series of CAT scans and ultrasounds to search for the ovarian tumor.
I was very nervous while waiting for the results to come back, so we sat around and waited for the phone to ring again, and the call came back, and they said, "We found the tumor."
The CT scan and the ultrasound demonstrated a small tumor in the left ovarian region.
The tumor is the size of a golf ball, and it's the critical clue Dr. Dalmau has been looking for.
Based on the demonstration of the antibodies and subsequently on the demonstration of the tumor, this was the confirmation of this diagnosis, anti-NMDA receptor encephalitis.
Anti-NMDA receptor encephalitis is an autoimmune disorder in which the immune system attacks structures in the brain called NMDA receptors. In a healthy individual, the immune system fights off infections. But in patients like Kristen, the immune system malfunctions, attacking the NMDA receptors. This in turn results in emotional and cognitive impairments, as well as problems with respiration and heart rate.
We don't have an idea what triggers this immune response in these patients. The NMDA receptors are critical for the function of memory, learning, behavior, cognition, and disruption of the receptors affect all these functions.
All of these medical difficulties seem to be illuminated by this one light, and I was really cautious with myself about not getting overexcited, but it was almost impossible not to.
Dr. Dalmau explains that in Kristen's case, the disease was triggered by the presence of the tumor in her ovary. He suspects the growth contains brain tissue, and that's what's been confusing her immune system all along.
The presence of this tumor triggers an immunological response. This immune response attacks the brain of the patient.
That brain tissue just happened to be exactly the same as the brain tissue in that part of her brain where the fuzzy image showed up. So rather than being a tumor or any kind of infection, it was her body attacking her own brain.
As the wires in her brain got crossed, vital organ systems in Kristen's body became seriously disturbed.
They can explain the breathing problems, the problems controlling the heartbeat. We know that the disease can be lethal.
Kristen's startlingly rapid mental decline is also typical of the disease.
Sometimes there is an increasing anxiety, and this evolves towards a change of mood and behavior and personality. The patient does not remember anything for weeks, sometimes for months.
I didn't realize that I had been out of it for 2 months. It seemed like days for me. I didn't know where our son was, where I was.
It's a blessing that she has no recollection of the really horrid things that happened.
But as it turns out, one of the most terrifying moments, Kristen's initial seizure in the ER, wasn't what it seemed at all.
She had some abnormal movements that happens frequently with this disease. Sometimes this can be mistaken for seizures.
With Kristen still in critical condition, she's immediately scheduled for surgery to remove the teratoma from her ovary.
I do remember asking him at the time, was there a likelihood that the tumor might be cancerous? And his response was, yes, there is a possibility of the tumor being cancerous. I was really scared, and I didn't know what to do.
4-year-old Tyler Berchielli hasn't had a bowel movement in the last month. And when his doctor administers a highly specialized enema in an attempt to find out why, the fragile young boy starts to vomit uncontrollably. Now his parents are rushing him to the emergency room.
We had a little bucket for him to throw up in. Andy drove to the hospital. I sat in the back seat with Tyler and helped him.
I think Andy and Janelle thought he might not make it home again. They were very, very frightened.
After giving Tyler a medication to control the violent vomiting, the ER doctors turn their attention to the real problem, his blocked colon. They call in pediatric surgeon Dr. Robert Gates to take over the case.
You look at these children and they are obviously helpless. They are in extreme discomfort. Tyler was breathing rapidly simply because his abdomen was so distended.
First, he orders a series of x-rays to find out exactly what he's dealing with. And as soon as he sees the images, it's clear that the little boy's intestines are severely impacted.
We proceeded to irrigate his colon in the emergency department. I was able to remove about 1.5 gallons of material from his colon. This is quite a bit of fluid to be retained in the colon of anybody, let alone a 4-year-old child.
After the irrigation flush, you could really tell his stomach went down. Like, it was the flattest we've seen it since he was born, basically. It was really amazing to see.
I told his parents that I was suspecting a number of different possibilities, but that he needed to be admitted to the hospital until I was 100% sure of this diagnosis.
Tyler was very stressed. He knew we were going to do something, but he wasn't sure what we were going to do.
As soon as Tyler is admitted, Dr. Gates walks the family through the next step in his investigation. He needs to perform a rectal biopsy, a surgical procedure that will take about an hour.
We irrigate the rectum and then take small samples of the rectal mucosa, and by analyzing that, we can determine whether or not there are abnormalities.
I'm kind of scared for him to have to go through a surgery. And we were very hopeful that we're going to find an answer to what was going on.
Everyone is anxious to know what the biopsy will reveal. And when the findings are in, Dr. Gates knows right away that he's found the critical clue he's been looking for.
The results showed that the child did not have ganglion cells in the wall of the rectum, which is diagnostic of Hirschsprung's disease.
Hirschsprung's disease occurs when nerve cells in the large intestine, called ganglion cells, don't form during fetal development. In a healthy individual, these nerve cells instruct the muscles in the colon to eliminate waste when it's full. But patients like Tyler don't have ganglion cells, so rather than passing through the colon, the stool simply stops moving, and over time begins to build up.
It would be like you have power lines running outside up and down the street, but you didn't connect the power line to your house, so the appliances are not going to work. And that's in essence what has happened with Tyler, is that he lacks the ability of the very end of his rectum to contract, and so everything else kind of backs up before that.
We were totally floored. None of us had ever heard of that disease before.
It was just a sigh of relief, actually, to know that they found an answer that we've been looking for the past 4 years.
But the news is bittersweet. Tyler will need to undergo an extensive round of invasive surgeries to help his colon function normally.
The way to treat Hirschsprung's is to surgically remove that segment of colon that does not function, the segment of colon that does not have the ganglion cells.
You're worried that your son's going to go through surgery. You know, it's like, well, it's really hard to deal with everything all at once like that.
But left untreated, Tyler's life could be on the line.
The dangers of Hirschsprung's are malnutrition, perforation of the intestine, development of the enterocolitis, a severe overwhelming infection of the intestine that can result in death.
Assuming the surgery is successful, Tyler will also need to wear a colostomy bag for several months.
His colon was so dilated that we were going to have to resect a segment of that dilated colon and give him a colostomy.
The colostomy will connect Tyler's enlarged colon to a surgical opening in his abdominal wall. Until his colon heals, his stool will collect in a small bag on his side.
We were, kind of nervous and not sure if a colostomy was something we could care for, but, finally we had an answer and Tyler could go on and live a normal life after this.
On January 24th, 2008, they wheel Tyler to the operating room. Janelle struggles to keep a brave face on for her little boy.
In the elevator, Tyler asked a question. Are they going to cut me open with a knife? And at that point, my heart just stopped. I was just like, he understands. And I just didn't know what to say to him. All my emotions came and I just tried to hold it together for him.
You don't want to show any fear to your son to know that he's going to go through something like that.
All Janelle and Andy can do now is wait. Four hours later, after Dr. Gates has removed 25% of Tyler's lower intestine, he pronounces the surgery a success.
He said things went really well and, we could probably go home in a few more days after recovery.
Over the next few weeks, the Berchiellis couldn't be more relieved as they watched Tyler regain his strength. Still, they can't help but wonder why it took more than 4 years for someone to figure out what was plaguing their son.
A pediatrician will see so many different patients with so many different issues, and they look for common things. One analogy would be if you go to a horse farm, you expect to see horses. You don't expect to see zebras and giraffes. And that's what Hirschsprung's disease is, essentially, is a zebra in the middle of a horse farm.
Not every doctor knows everything, so you have to keep searching and just don't give up.
Making it even more difficult to diagnose was the fact that Tyler's case is less severe than many children with Hirschsprung's. It is most commonly diagnosed in newborns who are unable to pass any waste at all during the first days of their lives.
With Tyler, he was able to pass some stool. He still was able to grow and develop and did not exhibit the striking signs of Hirschsprung's that we'd see until the last several months.
Kristen Gunther has just gone into surgery to remove a life-threatening tumor from her ovary. Now, the family is anxiously waiting to find out if the growth is cancerous.
When the pathologist examined the tumor tissue, it turned out that it was a cancerous type of teratoma.
I felt like somebody had punched me in the gut.
But despite the difficult news, doctors assure Roger that the cancer hasn't spread, and Kristen's prognosis is good.
This is a type of malignant tumor that responds to the chemotherapy, and many patients get cured.
But before they can even deal with the cancer, doctors must treat the autoimmune disease that has been eating away at Kristen's brain. For that, Dr. Dalmau explains a plasma exchange will be necessary.
The plasma exchange is a procedure in that the fluid of the blood that contains the antibodies is filtered through a machine that gets rid of these antibodies.
With the rogue antibodies removed from the bloodstream, Kristen's brain should start to recover. And within just 10 days, Roger begins to see a change in his wife.
And I grabbed her hand and she squeezed my hand. And I asked her, I said, "Do you know who you are?" And she said, in a very, very hoarse voice, she said, "Kristen." And I knew she was gonna be okay.
It was confusing when I first came to see myself hooked up to everything. I remember the first time I saw myself in a mirror was really scary. I didn't even connect that it was me, that I was looking at myself.
After 3 challenging months in the hospital, Dr. Dalmau gives the family the news they've been praying for. The plasma exchange has eliminated the antibodies from Kristen's body. She can now safely begin chemotherapy.
Going to the chemotherapy was exhausting, but it wasn't nearly as bad as I would have expected it to be.
9 weeks later, the doctors pronounce Kristen cancer-free.
There was that moment of euphoria and just knowing that it was solved, or feeling that it was solved, and that she would be back to 100%.
Now that they can see the light at the end of the tunnel, the Gunthers can't help but wonder why Kristen had to come so close to death before doctors could pinpoint the cause of her problems.
This disorder is relatively new. By the time that the patient was diagnosed, I believe we had diagnosed around 14 patients.
But with the underlying cause, the tumor removed and the antibodies eliminated, the disease is definitely gone for good.
She doesn't need to be very concerned about this disease coming back. Her neurological function is 100% back to normal.
Today, Tyler has regular bowel movements with the help of his colostomy bag.
He's definitely got used to having the colostomy on him. He doesn't want us touching it at all. Like, that's his job. His job is to remove the colostomy.
It was much easier than I thought it was going to be, just as easy as it is to change a baby's diaper.
After 2 more surgeries, Tyler will be able to start using a toilet for the first time in his life. And despite the fact that he still has a long way to go, the Berciellis remain inspired by their young son's courage.
Even when he was as sick as I've ever seen him, I knew that he would pull through, because this was the baby that we had wanted for so long, and he was strong, and he was a fighter, and he wasn't going to give up.